Which of the following is a contraindication for selecting a venipuncture site? So now let's review some of the reasons why you would pick versus not pick a certain site. So let's say this is our patient's arm right here. And let's say that this is your vein, right? So the whole idea is that you want to try and start, if possible, lower down. Because if, let's say, this is where you attempted, and let's say when you attempt that you missed the vein, it blew, meaning maybe you didn't actually get into the vein, you went through the side, and now it's damaged and you can't use it. Therefore, anything below, you should avoid using, because once it's damaged, then anything below it is going to have to then go through the site that you damaged. And when we say damage, it'll heal, but in this context, it's damage in terms of we can't use it for the IV or the blood draw or whatever you're using it for. And therefore, you want to then go above the site once it's already blown so that there's no puncture and that everything could go smoothly. Therefore, it's best to start lower if possible so you have more room to work with. And then again, going with that is any sort of injury to the vein, any sort of trauma, you would want to avoid that site for those reasons as well. So let's look at the choices and see which one matches these ideas of contraindication. And reminder that contra means opposite, and then indication means the reason to do something. So opposite the reason. So reasons that we should not select a certain spot or a certain vein for a venipuncture or a blood draw. So option A says vein is visible and palpable, and that would actually be a good indication for picking a certain vein. You might not always have that option, but when you do, it's very helpful if you could see and feel the vein, because you won't have to try and go much deeper or try and go in a difficult spot to try and get the vein. Those would be like your easier points to pick. So we could eliminate that because that is not a contraindication. That would be an indication. Option B says the vein is free from any obstruction. So free from obstruction. So there is no obstruction, nothing blocking it. And that would also be a good indication to pick a certain spot. So we can eliminate that. Option C says the vein is straight. And yeah, the straight vein might actually be easier to get to than if it's at an angle, which is still possible, but like over here, there's a little bit of an angle, but you would want to position your needle in the direction of the vein. So it would kind of go this way, or if you're going up here, you would want to go straight up like that, but that's not a reason to not pick a vein. It just has to do with the way you're going to position your needle. So we could eliminate option C. And then option D says presence of a hematoma. So a hematoma would be like an injury to the vein. Like when we were talking about any trauma to the vein, that would be a reason to not pick the site. The blood draw wouldn't go through easily. You wouldn't be able to get the results. And also that would be uncomfortable for the patient. So that would be a contraindication, which is what we are looking for. So option D would be your answer here.